Coming up on Paramedics Emergency Response.
I'm so scared. I can't feel my leg.
Can you feel me touching you back here?
If that's the case, this could be very serious.
How's it going?
I'm trying to make it to the hospital. I can't do it.
It's clear that he is exhausted. He needs to get his lungs opened up right away.
As we pull up on scene, I see Ozzy, someone that we've dealt with many, many times before.
Don't fall, no one's gonna catch you. I got you.
Yeah.
Hey, look at that moon. That's kind of
it's
cool.
pretty.
It's like half of a
It's
moon.
like a Halloween moon.
Yeah, it's kind of orange too.
They
a
might
little
call
bit.
that a half moon.
Half moon?
Yeah,
Is it? Can you
it's
make
like an
it
actual term. No, that's a real term. Crescent moon, half moon, full moon.
Yeah. Okay. I'll buy that.
Case 227. You're responding with Bravo for a 22-year-old male who jumped over a fire hydrant, suffered an injury to his neck and back.
The dispatch information states the patient jumped over a fire hydrant.
States he can't feel his legs.
So we're going to take every precaution to protect his neck and back.
There's a fire hydrant.
He's flashing his phone towards the fire hydrant.
So forth. We are 21 in the area at the fire hydrant. We don't see him. We arrive on scene and the patient isn't anywhere to be seen. Should we get out and have a look?
I guess so.
I mean, this is the location. I don't see a park here though.
Maybe.
I get out of the ambulance to look around.
Maybe if we turned the.
I could see the patient flashing his phone at
Yeah,
us.
there it is. He's just down like half a block.
As we approach the patient, he's laying on his back beside the fire hydrant with his cell phone in the air.
Hey, buddy, you can put your phone down.
As I approach the patient,
What's going on?
the way he's laying doesn't really seem to match the type of injury that he's reported.
Can you wiggle your toes for me?
I can't feel anything down.
Regardless, we need to assess his injuries and see how bad it is.
I can't feel anything. I'm serious. I can't.
We're going to take all precautions and treat this as a legitimate spinal injury.
Yeah.
I use my thumb to check for pedal reflexes. It's just to see if his foot will move away from that painful stimulus. His doesn't. He's saying that he can't feel or move his lower extremities.
He's got no pedal reflexes.
And if that's the case, this could be very serious.
Okay.
Try to relax, okay, buddy?
I'm scared.
Can you feel me touching you back here?
No.
You can't feel me touching your head?
And he doesn't have any physical injuries that I can find on my head-to-toe assessment. So we're basing this all off of what he says he's experiencing.
Pelvis is stable, his legs are no injuries. Head to toes unremarkable.
So what happened exactly?
I jumped over the fire hydrant and I missed it and I went backwards. I'm so scared. Sorry.
The odds of you getting a spinal injury from that type of fall is very low. So everything we're doing right now is to protect your neck and your back and your head till we can get some x-rays. But the possibility isn't zero.
I can't feel my leg.
We understand. What's gonna happen next is we're gonna put a board underneath you. We're gonna pick you up off the ground. In my experience, people that have a spinal injury have a different reaction than this patient does.
Can you turn off my phone?
Turn off your phone yet?
The only thing somebody is worried about when they do have a spinal injury
1, 2, 3.
is their legs.
You got my shoes?
Yep, we have your shoes and your phone.
They're not worried about their wallet, their phone, their shoes. The only thing they're focused on is their legs.
Okay.
Everybody's here.
Any back injury can be serious.
C-test 3 for 1967, or 10-4, code 8 on scene.
When you damage the spinal cord, you can get some paralysis from where the injury site is.
I can't feel my leg.
I don't think this is the case for this gentleman, but we'll have to wait and see.
This to 67. Responding for a 20-year-old male having an outburst attack with difficulty breathing.
1967 copies. Call info comes in for a male patient with extreme shortness of breath with an asthma history. All right, so shortness of breath seems to be the theme of the day.
Short of breath, asthma attack on the street.
Yeah, known history.
I think to myself on the way to this call is, why is he outside? How come he's not at home, and what's caused this? Is it an environmental problem?
He is leaning against the fence wearing a yellow sweater.
We pull up on scene and our patient's extremely tired and visibly working hard to breathe. Hey man, how's it going?
I'm trying to make it to the hospital, I can't do it.
Okay, come on in here, okay? Watching the patient climb into the truck, come on in here and we'll get you sitting down. It's clear that he is exhausted. He needs to get his lungs opened up right away. Let's get you on.
Can you slip your coat off?
Yeah, slip your coat off and we're gonna take a quick listen to you. So you're known asthmatic?
Yeah.
You had a cough or cold, been sick lately? Our patient instinctually puts himself into the tripod position with his arms down in order to open up his airways as much as possible. Concentrate on breathing for a sec.
I can't.
Okay, we've got an inspiratory wheeze in the bases, Brett. Can we get a neb?
So we mix up Ventolin and Atrovent, and that's going to get administered to the patient through a nebulizer. He'll breathe that in, and it will open up his lungs.
Wheezes both sides, satting 91%. Yeah, your heart's going pretty fast because you're working so hard to breathe.
Started a couple days ago, yeah.
Yeah?
On the job.
On the job?
Think I should wear a mask next time or something.
Our patient says his asthma is normally very well controlled. Make yourself comfortable for now and we'll get that medicine coming. But he's ran out of medications about 4 hours ago, and this attack just isn't letting up. Yeah, it's coming. He's got it right here.
Window.
We're doing everything we can, buddy.
I know.
I gotta get it all mixed up. Here it comes.
Would you prefer to sit on the bench?
Yeah,
Yeah, there you
Yeah, go ahead.
Just turn around. There you go, bud.
Is that your nickname, Wheezy?
We've treated him with some medication that's opened his lungs, and he's feeling much better. And we're going to transfer him over to the hospital now to get his lungs looked at, an x-ray, maybe some more medication.
You know, in the last few years, mental health has become just as important as people's physical health, if not more important.
3, 2, 1.
This is a job where you're dealing with a lot of really stressful situations. And we're jumping call to call to call.
The demand of the job is extremely high, and the expectations on performance, extremely high.
Your mental health has to be a priority. You can't help someone if you haven't helped yourself first.
Sometimes it's hard to leave everything at work. Part of that follows you home, no matter how much you try not to.
East to 27, you're responding Delta for an unarranged male called into police as bleeding from the face. All other details are unknown.
That's it. Tavors, code 8 on scene.
Negative, they do have a call in, but no one on route.
Tavor.
So usually we'd wait until police get on scene if it's an assault.
Yeah.
But it's in a public place,
Yeah.
and I feel like
It always does seem a little bit less sketchy, hey, when it's out in public.
Well, when
and
you're walking to someone's like basement.
then you're screwed. If you get
Yeah,
pinned down in
absolutely.
there, you're in trouble. But out in public, I'm just gonna run faster than you, and I should be okay.
Yeah, that took me a second.
We arrive on scene and police are already there.
I think it's Josh's brother. You guys find him?
He's just drunk right now, so I don't know. He looks like he just got in a fight.
The patient appears intoxicated.
Hello.
He's got some dried blood on his face and chest. He steps out of the cruiser and he's a little unsteady on his feet.
What's up? I was just stay there. How's it going? What happened? By what?
My ex.
Did she punch you in the face?
How the hell should I know?
My first impression with this patient is that he's not going to be very forthcoming with what happened tonight.
Okay, do you have all your teeth?
I'm trying to figure out if he got punched hard enough to affect his level of mentation.
What?
Are you missing any teeth?
Or if it's just intoxication.
No.
Are you hurt anywhere?
My pride?
Maybe we'll check you out in the ambulance?
Yeah. Do you want to get checked out in the ambulance, or do you want to go sleep it off?
No, I want to get checked out in the ambulance, man.
Yeah,
Sure, that's cool.
way better deal.
When given the option, almost everybody picks a ride in an ambulance over a ride in a police car.
Have a seat right there.
What's up, bro?
Do
My twin brother being a police officer, we're bound to run into each other every now and then. It's a small city.
We got called that there's a guy at the 7-Eleven. He was trying to get into the doors. He's covered in blood. They didn't want to let him in.
Drugs tonight?
No, just beer.
Okay. How'd you get into this fight?
I didn't get into a fight.
Well, what did she do? She just came at you for no reason?
No.
Well, what did you do?
Gave her an option.
What was the option?
Where did it happen? Over there. Okay, well, where's over there? Around the curve.
Were you there with a new girlfriend, maybe?
Who did it? Those guys. Those guys. Them.
Your blood pressure's a little bit high. I think you're a little bit amped up right now.
Yeah, because I'm a diabetic.
Oh, are you? Should we check your blood sugar?
Once it's cleared, we'll put him in the car and we'll figure it out. But...
Your sugars are high.
No, I'm just waiting.
What are your sugars normally at?
How the hell should I know?
Do you not check them ever?
I have checked them once.
Once. Something you should probably be doing, hey?
Untreated or unmonitored diabetes can lead to some pretty serious consequences. And it seems like the truth is kind of coming out now.
Suicide's never the right answer, right? So she was trying to leave you. You said you were gonna end your life, and then she hit you?
This patient's physical injuries don't require much medical intervention, but psychologically, tonight he needs someone to talk to. So we're gonna take him to the hospital.
Base to 1967. Charlie response for a 90-year-old female patient. Plenty of chest pain, difficulty breathing, and paralysis in one arm.
1967 copies. Our call information comes in for a 90-year-old female with multiple ailments. Let's get this figured out.
The patient has been complaining of shortness of breath, chest pain, and paralysis to her right arm.
She's 93?
Yeah, watch this. She won't have any medical history at all.
We can't be certain at this point what the presenting problem is.
93 and living in an apartment. That's really awesome.
We need to get on scene so we can try and narrow down exactly what's going on.
You called for us? Okay. Who are we here for?
Doris.
Doris?
Yeah.
Is she a relative of yours?
My mother.
Your mother?
Yeah.
Okay.
Hello. Hello, are you Doris? Hi, Doris. My name's Ben. What's happening today?
I just got up and I can't do anything with this.
1967. Do you have any other pain anywhere? The first thing we do is a stroke assessment to rule out that she's having a stroke. Can you squeeze my hands as hard as you can with both hands? Squeeze, 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 squeeze.
So face, nothing?
Face, nothing.
Arms?
Arm, nothing. Speech, nothing. So she passed the stroke test. Once we know that she's not having a stroke, our next objective is a cardiac exam.
You have a pacemaker?
Yeah.
1940.
She has a demand pacemaker and it's not running at this point, so we're going to do a 12 lead to rule out a heart attack.
We're going to take a picture of your heart here, okay?
You good?
Yep, we're all good.
Can you tell me what's happened tonight? What's going on?
Well, she woke up about a half hour ago. She was feeling a little dizzy. She said her hand wouldn't work, and she was starting to get chest pains.
Chest pain?
Yeah.
We've ruled out stroke. We've ruled out cardiac issues. At this point, we're no closer to a solution than when we started.
Do you have pain right now?
In my chest.
What have you been doing?
Nothing.
Dancing? No dancing?
All right. So this patient may not be in the best physical shape, but she still has a sense of humor. Speculation.
There we go. So far, we've covered all of our bases. We've taken the picture of her heart. We've given her medication for her pain as well as ASA in case she is having a heart attack. We're going to zip her up to the hospital, get her checked out, and figure out if we can see exactly what's going on with her.
Now, all this stuff we're doing here, sir, is just precautionary, okay?
Watching Tom with patients is amazing. He's a genuinely nice guy. He's so good at building rapport. You can just tell that he really, really cares about these people.
Just bear with me for a second here, okay? There.
And it makes them trust us really quick, so it's then easier for us to do our job.
Did she tell you why she was upset or anything like that?
Tom brings a calmness to a call. He is a great primary care paramedic.
For trauma alert to you, CTAS 1.
There isn't a person I know that doesn't look up to Tom. Tom is everybody's role model.
Let's get you covered up. You must be very cold.
You're responding for a 20-year-old male. Unknown problem. Patient is conscious and breathing, found laying down. He's on the bench in that shelter in the park.
The call comes in. It's a 20-something-year-old male who's possibly unconscious, possibly sleeping in the park.
So far, we copy that.
This is a very, very common call for us.
Maybe he's just sleeping.
I'm pretty sure this is someone just like hot and having a nap.
Sure, why not?
And people are too scared to go and check to make sure that they're alive.
And
so they call
rightfully so.
911. Is it?
I don't
though?
know if I'd want to approach somebody laying in the dark.
It's just like a foot tap.
What's that?
Just tap them with your foot, see if they move. Treat them like a zombie.
Sometimes they get
Double
up
tap.
and get punchy.
Yeah. Or stabby, I guess.
Yeah. So he's either sick or maybe not sick at all. We'll figure it out once we get there.
That's what we're here for. Oh, it's Ozzy.
Oh, man.
As we pull up on scene, the police are already there, and I see Ozzy, who is someone that we've dealt with many, many times before.
You guys.
Hey, we didn't. It was the dispatch. We didn't call you. So he's complaining about having trouble breathing, and he's
Okay.
actually sober for Ozzy. So,
Okay.
I don't know. Maybe just see.
Sure.
We have calls that are critical and calls that are clearly not critical.
How you doing?
How many million people have to come over here for one person?
You get the deluxe treatment.
You know, at least Ozzy's funny, he's fine to deal with, he's generally an okay guy.
Come with me.
But he's usually been drinking.
We didn't have a lot to go on. A call came in just that somebody was laying on a park bench here in the park and was asking for help and saying they were dying.
My name's Tom. That's Corey.
Have a seat.
When we rolled up, we saw Osborne, who we've dealt with before, and he was complaining of a bit of sinus pain and having trouble breathing, so.
What's going on today, Ozzy?
Say that memory, yeah.
It becomes quite evident that he's in no medical distress.
Can I say that?
Initially, the police report that he was complaining of trouble breathing and some sinus pain. He doesn't seem to have any complaints right now, but we'll check out his vitals and make sure that everything's good.
Your oxygen sats were pretty high, so that's good.
My what?
Your oxygen sats.
Your blood pressure is good. Your glucose is good. Your heart rate is good.
Ozzy's not really having any medical issues tonight, so fortunately, we can just release him on scene.
Don't fall, no one's gonna catch you. Oh my God.
This patient goes to leave,
Hey, Ozzy. Whoa.
and if it hadn't been for Brooke, he would have stepped directly into traffic.
Don't like wander into traffic though, okay? Come here.
Ozzy's vitals are good. He doesn't want to go to the hospital. He can go home and sleep it off.
What's going on? Can you wiggle your toes for me?
Regarding the patient from earlier in the evening who jumped over the fire hydrant,
I can't feel my leg.
We understand.
he was treated at the hospital. X-rays were clear. He had no damage to his spinal cord.
How's it going?
I'm trying to make it to the hospital. I can't do it.
Regarding our asthma patient earlier in the evening,
Would you prefer to sit on the bench?
he was stressed at the time. He was homeless, which probably aggravated his symptoms. So he's no longer homeless, and he's enrolled at SAS Polytechnic.
By what?
My ex.
Did she punch you in the face?
Regarding the patient who was punched by his ex-girlfriend,
Are you hurt anywhere?
My pride.
Maybe we'll check you out in the ambulance?
Yeah.
he was assessed at the hospital and then discharged when sober.
Hold your arms up. Keep them up, keep them up, keep them up, keep them up, keep them up. Good, that's awesome.
So Doris did have a stroke that night.
I just got up and I can't do anything.
1967 call.
She is doing much better and looks great. She does have a lot of movement back in her right arm, and she is still dealing with her arthritic pain.